Now, it's very important to talk about the stages of cervical cancer before we give any form of treatment that we can give to these patients that we come in contact with in these our clinical areas. Now, staging of cancer is done clinically, not surgically. And when we are staging cancer, there is always a general rule. And the general rule states that the more invasive the cancer becomes, the greater the distance from the cervix towards the vaginal opening. We'll see what that means when we start staging cancer. And the most important thing is what we want to do is we want to start staging cancer using these diagrammatic forms. These will help us to understand the stages of cancer in a way that we will not be able to forget it quickly. So first we start with the genital tract. So here we have the uterus. And of course this is the side view of the uterus. And this is the cervix, and just after the cervix we have the vagina, and the cervix enters the vagina at 45 degrees angles. So here is that kind of 45 degrees angles, and we know that the vagina is arranged in these folds called the lugae, and they are there to increase the surface area of the vagina during birth, of course even during coitus. That's the reason why the women's vagina can extend, can dilate. It's because of these, the lugae. And just on top of that, in front, we have the bladder, and we have the urethra also coming from the bladder. And behind that we have the rectum, that's the sphincter of muscles. Of course the anus, and of course there we have the intestines. So here is the female genital tract on the side view. So there we have the 5 vertebral bones, the sacrum, the iliac, and we want to talk about the side view of the cervix. So we imagine that this is the cervix, because cervical cancer is cancer of the cervix. So we want to take this view of the cervix and zoom it a little bit so that we can have a clear view of what this cervix is. So here we have the cervix. And of course we said that the cervix enters the vagina at the right angle. So here is the cervix, and this is the vagina. So now staging of cancer depends on the progression and the proceedment of this cancer and the degree of damage that the cancer cells are going to cause. So for example, staging of cancer starts from stage 0 up to stage 4. So we are going to start stage 1, stage 0. Now, stage 0 of cancer, this is also sometimes called carcinoma in situ. And in this stage of cancer, the cancer cells are there once examined on the microscopic examinations. But the thing is that the cancer cells have not yet started invading. They have not yet started invading the cervical tissues, the cervical cells, but once examined, it is showing that the cancer cells are there. So point to note is that the cancer cells are non-invasive, and they are there, but they have not yet started invading, and they are only at the part of the cervix, at the top part of the cervix, because if they are not invaded yet, then that simply means they will not spread anywhere. And this is the type of cancer which has it has the best response to treatment. This accounts for quite a high percentage, a number of people who are going to be treated. It responds well to treatment because it has not yet progressed and it has not yet started invading. Now, invasion starts in stage 1. So stage 1 of cancer, we'll just remove this first. So this is we talk about stage 1. Stage 1 of cancer is where invasion starts from, and stage 1 of cancer involves only the top part of the cervix. So there's a part, the cervix, the top part of the cervix is the only one which is involved, and this is in stage 1 of cancer, stage 1A. So stage 1, here is stage 1. And stage 1 is further divided into stage 1A and stage 1B. They are still here. The only difference is that in stage 1A, the cancer has just started invading, but it is not showing any lesions. The cells are still normal. That is what stage 1 is. So stage 1A, no lesions yet. No any form of lesions. The cells are still normal, but they have started, the cancer has invaded the cells of the cervix, and it's still on top of the cervix. Stage 1B, that's stage 1B. In stage 1B, the lesions have started forming. There are some forms of lesions which have started forming in the cervical cells once examined on the microscopic examinations. So there are lesions. That's in stage 1B. Still on top of the cervix. Stage 1A, no lesions, but the cancer has invaded. Stage 1B, there are lesions, the cancer has invaded. That's what is all about stage 1. Now, stage 2, we move on to stage 2. So stage 2 cancer. So here we have this is the cervix. And the vagina, of course. And we know that the cervix is attached to the pelvic, to the pelvic walls via the ligaments. So these are the ligaments. And what's the name of the ligaments that attaches the lower part of the cervix to the pelvic walls? And these ligaments are situated just inferiorly the broad ligament. So on top we have the broad ligament. Down there we have the transcervical ligaments or the cardinal ligaments. So here is the pelvic wall. We have the pelvic wall and the ligaments, the transcervical ligament or the cardinal ligaments. So here is the cardinal ligaments. And these are the ligaments which are attaching the cervix to the lateral walls of the pelvis. We have talked about stage 1 already. Stage 0, still here, not yet invasive. Stage 1, invasion has started. Stage 1A, there are no lesions. Stage 1B, there are lesions. Now we want to move on to talk about stage 2. Stage 2 is going to involve the upper part of the vagina. So here is the cancer has started here, and then it will involve even this part of the vagina. So these are the cancer cells spreading, and we term this, when this happens, we term this as stage 2 cancer. This is the lower half of the vagina, the lower third of the vagina, not infected, not affected rather, sorry. So this is stage 2. We are in stage 2. Now, the way we look at this is we always term as this part, this middle part here, there is always going to be stage A of either side. So for example, if it's stage 1A, then it's going to be within this range. If it's stage 2B, stage 2A, it's going to be in this range. Stage 3A, it's going to be in this range only. But when you talk about the B's, for example, stage 2B, it's going to involve this side and other sides. Stage 3B also is going to involve this side and other side. What I mean is this is stage 1 of cancer. This area here. From here to here, it's stage 1. Stage 1, stage 2A. So this is stage 2A, from ear to ear. And then stage 2B is going to involve these sides. Once it invades this side, the lateral walls of the ligaments, not reaching the pelvic walls, even this side, even here it's the same. So this is stage 2B. Stage 2B. Stage 2A, stage 2B. Now stage 3. Stage 3 is going to involve the whole part of the vagina is going to be infected. It's going to be affected rather. And it's going to spread from the cervix towards the whole part of the cervix. So that is stage 3. So here is the stage 3. The cancer has now moved from the cervix, stage 2, stage 3. So this is stage 3. When it involves the vagina, the whole part here, stage 3A. So this is stage 3A of cancer. And if the cancer has moved from this side towards the lateral walls of the cervix, towards in reaching the pelvic wall. So when it reaches in, these are the pelvic walls are going to be involved. Then we term this cancer as stage 3B. So this is stage 3B. Stage 3B. Stage 3A. Only not these lateral walls, but all these are involved. That is stage 3B. Now, stage 4, this is the most dangerous type of cancer. And the only treatment for that is surgery, radiotherapy, chemotherapy, as we know the types of treatment that we give to cancer people. Stage 4 is going to involve some other organs of the body, of the female reproductive organs and other bodies. So for example, if it's stage 4, it's going to involve all these areas. Even these areas are going to be involved, the pelvic walls. And once these are involved, then there is going to be involvement of the lateral walls and the anterior walls. All those, for example, Here we have the uterus. So this is the cervix, and behind that we have the rectum, and in front we have the bladder. So this is the vagina opening, the cervix, and the cancer that spreads, the cancer that is in stage 4A, it's going to involve even these lateral walls. The front, the bladder is going to be involved, and once the bladder is going to be involved, once the bladder is involved, then that can cause what we call the vesical cervical fistula, an opening, an abnormal opening between the two cavities, and that can cause, that's the only thing that causes leaking in when we talk about the clinical signs and symptoms of cervical cancer, because there's going to be a fistula that is in stage 4 of cancer. It's going to involve the bladder, the rectum, all those things are going to be involved. But when it's stage 4B, stage 4B is not only going to affect these pelvic organs, it's also going to affect other organs. For example, the lungs, the breast, and other tissues of the body are going to be affected. Even the intestines can be affected. So point to note, cervical cancer stage 4A affects only the pelvic organs, but cervical cancer 4B can affect some other parts of the body which are further away from the pelvic organs. For example, the lungs, the large intestines, the breast, all those things can be affected in these types of cervical cancer. So we have a recap. Stage 3 is divided into stage 3A and stage 3B. Stage 1A, and stage 1B. Stage 2, just like that. And here is the diagram that will always help us to remember. So this is stage 3. 3B, stage 1, stage 1A, and stage 1B, it's in this side. The only difference is differentiation of the lesions being forming. Being in stage 1A, the lesions not yet. Stage 1B, the lesions are going to be there. So if it reaches only this side, then cancer is 2B. Only here, 2A. This whole part here, from here to here, is 3A. 4A involves the pelvic organs, and 4B involves some other parts of the body. The next, we are going to talk about the management of cancer.